Okay, good morning, everyone. Thanks for jumping on Zoom on a little short notice. We thought it would be just a good idea to have the county executive walk through what we've been doing at the county level, and um, and then open it up for questions afterwards. Want to make sure that we all get time for questions, and we'll try to coordinate that by just kind of calling the roll. There are not that many people on the call, so we'll just go down the list and call people and see what questions they have to start out with, and then we'll go. And you certainly can always raise your hand, and I'll be able to see that as well. Before I turn it over to the county executive, just to let you know that we do have slides that we're going to be going through. The county exec will be going through, and we'll send those to you after the meeting as PDFs if you want to use them for your reference or for screen grabs later. We be able to do that. They should be high res enough to be able to do that. And with that, I'll turn it over to the county executive.
Well, thanks, Bill, and thanks for those of you who are on the call. I want to kind of walk through where we are currently with the COVID pandemic issues, and then talk a little bit about the county's response in some different areas with respect to how we got where we are. So I think the first place is, where are we now? And right now, like most municipalities and others, are suffering from the expenses and lost revenue from COVID. And so, where we for this fiscal year had a projected budget surplus of $5.7 million, we're looking now at a budget shortfall of about $157 million. Obviously, to try to deal with that, we've instituted, as of today, several things. One is layoffs and furloughs. And let me just say for a minute that our goal is to reduce staff. Was the last thing we wanted to do anyway. But to the extent that we had to reduce staff, we chose to do it with furloughs that would allow the county to continue to pay the health care benefits for our employees and allow them to collect unemployment. This involves about 4 different bargaining units, collective bargaining units with the county, 3 of whom accepted the furlough, and the county commission approved it at their meeting yesterday. The other union chose not to, and so their members will be laid off in terms of collective bargaining, seniority benefits, seniority rights. The second thing is hiring and contract freezing. Obviously, we have like a number of places, we have unfilled positions, and we have positions that we were going to fill before the pandemic. That's certainly not going to happen now. And so those positions for hiring and contracting will freeze. Many of our contracts, not only are we freezing new contracts because these are issues we're not going to be able to get to currently, but also a very serious review of all of our existing contracts, because since we've been put on hold by this pandemic for a period of time, it's possible that many of the contracts we have, in fact, it's plausible, can be reduced or terminated because they just are not going to fit in the remainder of the year after this pandemic. Salary and wage freezes, obviously. We were in collective bargaining agreements with some unions. Right now, we're going to have to freeze salaries and wages. And unlike the Wayne County of 5 or 6 years ago, we have a rainy day fund now that we've kept and built up, which is good accounting practices, but it's also something we didn't have 6 years ago. And obviously, if there ever was a rainy day, the rainy day is now. So we'll be tapping the rainy day fund. And we're also in the process of trying to craft a 2-year budget, because not only is the shortfall going to be this year, but obviously with businesses in very tentative situations, it's going to take a while for folks to be able to bounce back if, in fact, they can. And with the number of layoffs that have already occurred, it's going to be very, very clear that people are going to have difficulty paying property taxes, and revenue that's lost from a number of other areas is going to go past the end of this fiscal year. So we're trying to look off into the future. The county is going to furlough 227 employees. There are 606 open positions that will go unfilled, and we expect the savings from those to be a little over $30 million. We signed an executive order which institutes the hiring and spending freezes that I mentioned just a little while ago. Vacant positions will be frozen, as I mentioned, and that's very much where we are in terms of our projections to move forward from here. Bill, if you give me slide 3. Slide 3 is a slide that starts to talk a little bit about just the COVID in Wayne County. As you see, there have been 675 cases to date, with about 750 deaths resulting. What the slide will show you is the slide on the left will show you the cases by race. As you know, there's been significant discussion about disparities in the COVID cases by race. More people of color, based on the percentage of the population, have been affected than others. And the slide on the right is currently blocked by something. So let me play here just a minute and try to see if I can move that so that I can actually see what's there. And the slide on the right indicates the relative ages of those people who have succumbed to the coronavirus. And while there have been over 750 cases, it's also pretty clear, if you look at the chart, that the vast majority of those who died were 80 plus in age, between 70 and 80. And so the toll with respect to deaths has been very, very significant the older that you are. And I think that's pretty accurate in most places, but it clearly is the case here. By community, you can see that obviously some communities have been hit harder than others. Detroit obviously being the largest and the biggest city, but clearly a number of other smaller cities have been hit pretty hard. Livonia, Dearborn, Westland, Taylor, Canton Township, and a few others round out the largest or more significant 10 communities in Wayne County. So what are we doing in Wayne County about the pandemic? What has the county done? The first thing I'd like to indicate, because as we're talking about furloughs and layoffs, I think it's really important to note that we made a conscious decision to keep everyone on the payroll early on, even though we sent people home for safety reasons, and many of these people were not allowed to or not able to perform their jobs from home. We thought it critically important to not add to the problems of the pandemic to families by also upsetting their income and upsetting their work. And so from 321 to yesterday, uh, everyone has been on paid furloughs that were non-essential workers. Now, obviously, the essential workers have come into work, and we laud their efforts, and they've done a tremendous job. Roughly 1,000 of the COVID tests have been administered to our employees, and we have really been uh, working on getting as much testing as we could for county employees, particularly those essential employees who had to come into the workplace. There's nothing more important than trying to protect them. And so that's an ongoing process. And as we start back to work, Lord willing, uh, testing will have to ramp up even more because we need to make sure on a daily basis that people coming to work uh, are not um, carrying the virus and putting other employees at risk. Wayne County's also deep cleaned all of our jails and essential facilities. That has happened for weeks, and we've been making sure that that was done the way it should be. Wayne County agencies, including the jails and the juvenile detention facility, were included, obviously, in that. We've administered PPEs, distributing them to all 43 of our communities as they came in and as they were asked for. Same thing with the Wayne County jails and the juvenile detention facility. Over 100,000 N95 masks have gone out so far, about 89,000 surgical masks, 78,000 plus KN95 masks, gloves, 200,000, and hand sanitizer. And so those supplies have been made available not just to county, but to the other communities in Wayne County outside of the city of Detroit. On the public health side, we've opened up testing sites. One in Southgate is a drive-through site with Quest Diagnostics and Walmart. We have awarded grants to reopen Lincoln Park's Vibra Hospital for COVID patients. As some hospitals are starting to shut down, and that now is really good to be able to bring online a new hospital in a very short period of time and have them start seeing COVID patients. So that's Vibra Hospital, used to be called, I think, the old Lincoln Park Hospital. If you give me slide number 6, and look, play here for a minute and see if I can. If I can get the slide up farther. Slide number 6, from my perspective, deals with the community's assistance. Providing whatever assistance we can to families in need has been a big portion of what we've been doing, from food bank help to providing meals to first responders. Those sorts of things has been important. Also important, I think, very important to the county is the efforts we've put forward in terms of helping small businesses. We partnered with TCF Bank to have a small business loan program funded by about $10 million. And that loan program has allowed us to put between $5,000 and $50,000 in the hands of small businesses quickly. As you know, something like this happens. What kills small businesses more than anything else is that even if money is forthcoming, the time it takes for that money to get to them is often longer than they can bear to stay open. The first of every month, their bills are due. And so we're happy to say that we put a few $1 million in the hands of people as we speak, are already there. Many more loans have been approved. They're in the process of the people the businesses receiving their funds. And so we're happy to have done that. I mean, we're not naive. We understand that there are probably far more businesses based on the applications than dollars available. But $10 million being available on low interest loans is helpful to that process. And, we're very, very happy to have been able to do that. As I said, we've closed a number of those deals, and people are getting some of the funds that they need. You want to give me slide 8, please? So we also have had, along with the TCF Wayne County project, we've also had a joint grant offering with the city of Detroit, money coming from the MEDC. There have been 196 awardees, 72 have received $2,500 grants. Another 124 have received $5,000 grants. And so that's another small business initiative that we thought is really important for pretty much the backbone of businesses in Wayne County, which are small businesses. And our economic development team has done a great job in reaching out and working hard with those businesses. Slide number 9. Paying close attention to, and I mentioned a little bit earlier, the disproportionate impact that COVID-19 is having on the African American community. We see fully a 40% of all COVID-19 deaths in Michigan are African American, and most of those are in Wayne County. According to the New York Times, the increased level of poverty among African Americans is expected to double the increased rate of poverty as it would relate to whites. And so not only have people of color been disproportionately hit with the COVID virus, but the aftermath of the virus is also going to hit and cut very, very deeply in the African American community. One of the things that has been most important to me is to make sure that at the end of this pandemic, when we finally are beginning to recover, that we have the appropriate data to make significantly different decisions about how we provide health care and how we provide services as an aftermath of COVID-19. I mean, this has pulled the covers over some significant disparities, and you can't get at them if you don't have adequate information. And so through our health department, we have a continuing effort to make sure that the data we're getting is accurate data, is data that clearly delineates the issues that we need to be able to research once this is over. And one of those, quite frankly, as I started looking at the data, we were finding fully 30+% of those deceased were coming in as race unknown. That's just not logically possible. And so we've gone back to look at other data points to try to determine the race of the people who have died, along with age and other related things. Because, as I said, it's a golden opportunity for us to make some really strong structural changes if we have the appropriate data, and shame on us if we don't. If you give me slide 10, please. Unemployment and COVID-19. That slide will show you that the Michigan labor force is just south of 5 million, that in March, there were 200,000 unemployed workers, and since March 15th, almost 1.2 million Michigan workers have filed for unemployment. And because the general consensus is the spring back from this, even when the pandemic slows significantly, the growth back to substantial jobs for our residents is going to be a long haul and a significant um, situation that we're going to have to deal with going forward. That, I think, are the major points that I thought were important. We'd like to do this on a somewhat regular basis as we have new information to put forward. But to know where we are now, the kinds of things we're working on, I think are very, very important. And I'd be happy to try to answer any questions that you might have about anything I've said or things that you think I've missed. Bill?
Thank you, Executive. So I thought it would be helpful I'm just going to go across the top of the list of attendees and just call your name out. And if you got a question, we'll go through that. And after we go through the roll, then we'll just kind of open it up for any one-offs that you might want to have after that. So we'll start first with Dan at 7.
Thanks, Bill. Thanks, County Executive, for your time. Appreciate the update very much. I do have a few questions. I just want to start off first. There's a vigil tonight honoring COVID-19 victims. You're listed as among the supporters of that. Can you share your thoughts on the feedback you've received on the overall effect of COVID in your county, and then what this vigil means tonight to you?
Yeah, I mean, the overall effects is I don't think I've run into anybody, quite frankly, in the last month that hasn't been affected in some way, either by family, friends, or co-workers. The death last week of the young 5-year-old, I think, touches everyone's heart significantly. I can't tell you the number of people who are friends who have lost 1 and 2 parents in nursing home outbreaks, and so it's a situation that I think certainly should require all of us to take a deep breath and say a prayer for those who have been deceased and the families that have been traumatized so much by this virus. And I think that's what a community should do. And so I absolutely do support it. I think it's important. I think it's even to some extent therapeutic for those who are, grieving an issue like this, to realize there are some more people out there grieving too.
Thank you, sir. Bill, can I ask just one more follow-up
Sure,
question?
yeah, go ahead.
Sorry. County Executive, I know there's the prison populations and jail populations in the Tri-County area and also across the state. There's been a dialogue about testing, the amount of testing for staff and also for the inmates as well. That's drawn a lot of observation and some criticisms. From your perspective for the Wayne County Jail, can you talk about what's been done or what's being done in terms of testing staff as well as inmates at the county jail?
Yeah, we have definitely been testing staff. I gotta thank the city of Detroit for making some of its testing available, along with the ones that I mentioned earlier that we have. Critical to test those first responders who have to go into work every day. I mean, I've spent the vast majority of my life as a first responder, but I got to tell you, nobody's prepared for this. And so people, we've even made hotel rooms, contracted for hotel rooms for employees who needed to come in to work back and forth, but based on that, we're anxious about going home and possibly spreading the virus to family members. And so we have done that. And we are also testing, as the tests are available, those inmates, clearly those who are symptomatic, and we've tried to thin out. I think it's really important for people to know we made a concerted effort to thin out the jail population just to try to create more room for social distancing and those issues. Before the pandemic, we had roughly 2,000, give or take, inmates in the 3 county jails. we currently have less than 900. And there was a concerted effort by the sheriff, the prosecutor, and the chief judge of the circuit court to review files and find people that they thought could be released with the least amount of danger to the community, oftentimes on electronic monitoring, so that there were fewer people in the jail that were not confined so closely together. So those efforts have been made, and those are ongoing efforts. We have had inmates that were COVID positive, and we've had officers that were COVID positive, but it's been workable at this point, if there's such a thing as workable, and we've taken the appropriate action in those instances. I mean, it's a tough balance to decide whether or not people who are rightfully in jail based on the court system should even be released in the first place. But I think the better part of wisdom was that those three elected officials spent an awful lot of time sitting down, going over individual cases, and made decisions that I think were in the best interest of Wayne County. So I thank them for that.
Great. Thanks, Dan. Jackie?
Yes, hi. Thank you for the opportunity. I trust you can hear me.
We
I-
can.
All right. Good morning. My question is, when the county first announced that it was offering paid furloughs on March 13th, how many county employees were doing work from home versus how many were being paid but not required to work while at home?
You know, I wouldn't avoid the question. I don't really know the answer to that. My legitimate guess is that the majority of those were people who were home for safety reasons and could not work from home. But there were a lot of other essential workers who did come in and work. So I'm not sure the numbers, but we certainly understood that we would lose some productivity by paying people who were not going to be able to work through no fault of their own, but also an understanding that the pandemic is hard enough. We'll do what we can to try not to make an immediate financial problem on top of that.
Thank you.
Okay. Alan?
Yeah, can you hear me?
We can.
Yeah, so with the furloughs, obviously this will have an impact on the budget for a little while. Is there any anticipation of services that may not come back online from the county right away once this gets over? Or how will kind of prioritizing what comes back first be done?
Yeah, I mean the major things. It's a great question, and there for the last several years we haven't invested much money in nice to do things. They were all have to do. But even within the realm of have to do, there's some that have to be done more than others. And clearly, keeping our courts, our civil and criminal courts up and running, keeping the sheriff's department employees coming in, both in terms of security in the courts and to run the jail system, and the prosecutor's office, which is clearly critically important at this point, where some of the major concerns to keep going on my side of the equation more is road repairs, road contracts, those services, being able to keep our parks open, especially at a time like this where some of the only outside recreation people got was to go into the park. So we've kind of prioritized that, not venturing out into many new projects, but trying to keep a core of employees available and healthy to be able to provide the basic services that I just enumerated.
Great. Hewitt Media? Okay. Kirk?
Hey, good afternoon. Thanks. County Executive Warren Evans, can you give us a sense of what type of employees are going to be impacted by these furloughs? Are these clerical people, or what sort of employment classifications do they fall in, and where do you anticipate the biggest hit in your revenue streams?
Yeah, two good questions. I clearly, I'll take the last part of it first, Kurt, and that is, I think property taxes are going to be impacted significantly, and at the end of the day, that's probably going to be um, the biggest hit. Uh, but clearly now, the hits on and revenue reductions on airline parking, fees for projects with the roads and construction offices. All of them look dismal in terms of uh, the projection for revenue for the rest of this year uh, and into next year. The employees are all across the spectrum. Members of my staff have been furloughed because um, while they play an important role, we had to reduce the role. And in other places, that's the case. If there are administrative people who are certainly viable and do a good job, but are not critical at this point um, with respect to certain tasks, those people are going. So members of my executive staff, all the way down to seasonal workers and clerical people. For example, the circuit court, when it starts to get up and running, is not going to get up and running immediately all at the same time, and so there will be court clerks and other folk who may not be immediately needed, and if that's the case, we'll look at those. So they run the whole spectrum of job titles that we can temporarily do without, or job titles that need to be reduced because we're not going to be able to do the level of work that we would have had this not occurred.
If you don't mind me getting one more in, if I remember properly, and my math is right, this pretty much dwarfs any of the budget crises that were sort of fairly common during the Ficano administration, when the deficits were $50 million or $60 million here or there. Am I remembering that properly? And would you be able to help put that into context for how things were about 5 or 6 years ago?
Yeah, yes and no. Yes, the structural deficit then was about 52 million. Our budget structural deficit this year looks like about 152 million. So that's significantly different. But there also was an accumulated deficit of over 100 million before. No rainy day fund, nothing to fall back on. And so, yes, this is more significant on the short term in terms of the structural deficit. But on the other hand, we're far better prepared because, unlike before, we have a rainy day fund to the tune of about $140 million. And we don't have an accumulated deficit to pay off now. It is just the structural deficit. So, as my mother would probably say, 6 of one, half dozen of the other.
Gotcha. Thank you.
Yeah.
Thank you. Sarah?
Hello.
Hey, Sarah, go ahead.
Hi. Well, thank you, County Executive. I actually have two questions.
Sure.
One that you touched on a little bit, which is, we talked a little bit about, lack of record keeping and with COVID-19 and race, and how we need to study healthcare concerns after this pandemic. I know Mayor Duggan touched on that a little bit, and opening healthcare services as soon as possible. But are we missing an opportunity here to study what could happen afterwards?
We would be missing the opportunity if we don't have the right data. And that's why I've been pushing the health department to make sure that we're reconciling the data so that, again, I mean, I think we miss a golden opportunity here if we don't have the appropriate data to analyze and make strong recommendations to the healthcare industry, for example, about clearing up some of the disparities that make the number of deceased so significant. Other, people with other ongoing, medical issues that aren't being treated adequately. And so when something like the coronavirus hits, it hits them much harder than it does others. And so, and quite frankly, also kind of a review of hospital performance, because while I think hospitals have overall done a great job, I mean, we've had hospitals, a hospital in Wayne County that shut down. And it's shut down now during the crisis, and it leads one to question what the fundamental goal is, short of turning a profit, if if you close down. And I understand cash flow issues. I mean, we've got them too, but there are also, to me, some ethical concerns, particularly for hospitals that are nonprofit, which means they get significant tax breaks for being a nonprofit institution. And so, if in my mind they look like they're behaving as for-profit institutions, I think that's something we want to look at. And in fact, I made a request of the Attorney General to look into that.
And just outside of Detroit, which community has reached out or is the most concerning?
I don't know. I mean, we have ongoing discussions at the county at least once a week with all 43 of our communities, and our emergency preparedness director and others are in constant contact with them. Generally, oftentimes it's been them reaching out for testing sites, or us reaching out to find out if they had some viable testing sites. So I think most of the interaction has been, everybody would like to have testing sites closer to their communities, hoping to get more people tested. And obviously that's a major goal of ours too, because I think Detroit is demonstrated. You get the more people tested, you get a better view of what's going on, and you can see when you can identify the peaks and valleys a lot better. And by the way, it looks like both in Detroit and Wayne County that while there still are peaks and valleys, the curve is flattening some, which is a good indication of hopefully things get better soon. But clearly, that's all contingent upon people's individual behavior when that starts to happen, and whether or not the worst thing that could happen is we get a spike and have to go through all of this again.
Okay. All right, we've gone through the tally. Is there anyone else that has any follow-up or other questions at this time? I know we've kept you on a little bit longer than we said we would. Okay, well, thank you all for taking the time out of the day on a Friday to join us. We'll send around a PDF of the slides that the executive used during his presentation. We'll get that out to you within the next hour so that you have that information to go from. And if you have any follow-up questions or anything, you can certainly email me, or you can email Whitney, and we'd be happy to follow up with you offline. So thank you all. Thank you, executive, for your time, and have a great weekend, everybody.